Dear students, welcome back. In this session now we are going to discuss about the layers of abdomen. Okay, so already we have finished the anterior or anterolateral abdominal wall and also the posterior abdominal wall. So if you see the anterior abdominal wall, we have seen many layers, isn't it? So we have seen the layers in the anterior abdominal wall itself. The remaining, still we are having so many layers inside in the placement of visceral organs also. Okay, so if you see the layers of abdomen, the first layer of abdomen includes the anterior abdominal wall. This anterior abdominal wall includes the skin, yes, and then the superficial fascia, that is fat, and then this superficial fascia is having two layers, fatty layer as well as the membranous layer. After that, you can find the muscular layer, isn't it? So that muscular layer includes the abdominal muscles, that is external, internal, transverse abdominis muscles, and then after that transversalis fascia. The next layer to this one is the peritoneum. So all these together called as the first layer of the abdomen, that is anterior abdominal wall. So the first layer of the abdomen includes anterior abdominal wall. Okay, the layer 1 is anterior abdominal wall, and the next, after you open this anterior abdominal wall, the next layer of visceral organs which are present in the second layer is, the first one is liver, stomach and greater omentum forms the second layer of the abdomen, and below this layer you can find the third layer. In the third layer, the most of the small intestine, so this is the small intestine here, so this is the small intestine, and appendix, cecum and the colon. Okay, so all this forms the third layer. So the third layer mainly consists of small intestine, appendix, cecum and colon. Okay, and the next layer, that is fourth layer. So below this, so we have seen in the second layer of stomach, that is liver, stomach and the greater omentum, and the third layer small intestine and the colon, and after that the next layer goes to duodenum along with pancreas, forms the layer 4. Okay, next fifth layer, and behind this duodenum and pancreas, you will find the kidneys with large blood vessels. Kidneys and the large blood vessels included here. Okay, so this forms the fifth layer. So these organs will come in the retroperitoneal space. Retroperitoneal space. These organs are present in the retroperitoneal space. And the next layer, that is after this kidneys, next layer is the posterior abdominal wall. So we have finished this muscles of the posterior abdominal wall. One is the psoas major muscle and the quadratus lumborum, and also psoas minor and the iliacus muscles. These muscles forms the posterior abdominal wall, and also so many structures which are related to the posterior abdominal wall or the aorta, inferior vena cava, that one also we have finished, and also the lumbar plexus. So the nerves which are coming here, so these are the nerves of this lumbar plexus and its course. Okay, and then the sympathetic chain, that is autonomic part of the abdomen also included in the sixth layer. So these structures are related to the sixth layer. So all these are the layers of the abdomen. So why all these things you should know means, so many visceral organs are there inside the abdominal cavity. How these visceral organs are arranged from anterior to posterior, this is the way how these visceral organs are present inside the abdominal cavity, and these visceral organs are covered by the abdominal wall. This abdominal wall includes anterolateral abdominal wall and the posterior abdominal wall. So if you see the layers, the first layer becomes the anterior abdominal wall and the last layer becomes the posterior abdominal wall. In between these two, so the visceral organs are arranged. So the first layer includes liver, stomach and the greater omentum. So the first layer is anterior abdominal wall, and then the second layer includes liver, stomach and omentum, and next layer, that is third layer, includes mainly the intestines, okay, and fourth layer mainly includes the duodenum with pancreas, and the fifth layer kidney with large blood vessels, and the sixth layer is posterior abdominal wall. That two muscles of posterior abdominal wall and the structure, some of the vessels and nerves related to the posterior abdominal wall. So these are all the layers of the abdomen. Now if you know these layers, you can easily relate the structures. So if you take stomach, how the other organs are related to the stomach, you can easily understood. So the stomach is present in the second layer and the intestines are present in the third layer. So how the stomach and intestines are related, you can able to understand, you can correlate with it. How the liver is are related to the stomach, how the duodenum and pancreas are related to the stomach. Like that you can easily understand if you know these layers of this abdomen. Okay, in the next session we are going to deal with the soft part, that is stomach. Thank you.